So let's come back to where we started. The question really wasn't, can digital vision therapy work? Because I don't think that's actually the right question. The real question is, what has to be true for it to work?
Because it really has to preserve your clinical reasoning. It has to preserve your methodology. It has to preserve your decision making.
Decision making is key.
Yeah.
Because that's the thing. What all of the doctors that we speak to, they say like, oh, in my vision therapy room, I can change things on the fly.
Mm-hmm.
That's extremely, extremely important. So when we're thinking about changing things on the fly, how do you do that with a digital program?
Like, it can't just be a list of exercises.
You can't.
Here you go.
Exactly. And it can't just be videos that we hope that they figure out how to do.
It has to really help patients understand why they're doing what they're doing. And then when they understand that, they then have to understand how to progress, how to know when to progress, how to know when to slow down, how to know when to challenge, how to know what to reinforce.
And I think that that's the main reason why when it comes to Vision Adventure and building your own digital program, we love new docs. We want new docs to come into vision therapy. Vision therapy is the best career you can ever imagine. You get to change a life every single day.
More than just like, here's a pair of glasses, good luck, see you in 6 months or a year or whatever.
Exactly. And also, Vision Adventure is not for new doctors because that clinical decision making, you need to learn in your therapy room.
You can't learn that from a digital program.
You can't learn it, in school. Like in school, we learn a lot of things.
Mm-hmm.
We learn a lot of things. But in school, you cannot learn that clinical decision making. You need to have this patient having this issue while mom and dad are both asking you questions with research articles in their hands saying vision therapy doesn't work.
And the pediatrician says it's hokum. And
exactly. And
my cousin in Iowa spent $80,000 and her eyes are still messed up.
Exactly, because it's just snake oil and you're going to light incense. Mm-hmm. Like, you need that experience inside of you.
The fire, the warrior spirit.
Exactly. In order to be able to have that clinical decision making, that it's just like the back of your hand. You got this. You know exactly how to treat this patient. This is not like, I definitely agree that we learn something from our patients every single day. That's how it should be. You should learn something every day, every single day. I teach that to my kids. We go about that every day at the dinner table. What did you learn today? So yes, even the more seasoned practitioners should still be learning from their patients. However, the digital program is from the patients that you know already. And you need to have that built up underneath you in order to have that sturdy footing to be able to have your decision making in the program.
Exactly.
Because if you're still figuring out how to make decisions, if you're still figuring out what to do with this CI kiddo who doesn't want to practice, who's actually like an A- student, doesn't really matter if they get to an A+, if you don't know how to talk to him and his parents about his convergence insufficiency, you're not at the point where a digital program makes sense for you to create. We have amazing doctors who have created digital programs that you can definitely use in your practice as you're building up your in-office presence, as you're, marketing, as you're building up the other parts of your business, as you're developing yourself as a vision therapy clinician. Yes, use the digital programs of the years and years and years of knowledge that we've all put into them, but it's not time to create your own yet. The time will come. It's just not now.
And you can use, exactly, because you're using all of the clinical experience of these awesome, masterful doctors in your clinic as you're building your own, zhuzh, your own energy. Patients are coming to you for you. And they will also benefit from the expertise and the experience of the others who have come before. It sounds so mystical and wonderful, but my point is that you can then, kind of pool your experience and have all these different resources, because not every patient is necessarily from you and for you. And so you can use these different programs to be able to meet the needs of all the patients that walk in your door.
And then even if we think about it, like specifically, like Dr. Wally has his homeschooling program. And so he has a vision therapy program for homeschooled kiddos who have, obviously reading vision issues that are negatively impacting reading. And he's a homeschool dad. He has like 4 kids, and they homeschool all of them. And,
and he runs a practice.
And he's created this program, which is amazing for homeschool parents to incorporate into their daily homeschool curriculum. Now, as a new grad, I had homeschool kiddos, and I did not know how to pivot in the homeschool world the way that we needed to. And so it would not have been in my patient's best interest for me to have created a digital program for homeschool kiddos at that point in time. If Dr. Wally's program was available, that would have been amazing. I started vision therapy in a lens crafters where they said you could never do vision therapy. It was a mall lens crafters at that.
Yeah.
If there were digital vision therapy programs created by, people who actually know vision therapy, then that would have been amazing for my patients. But they, needed to go through the iterations of me learning, and I did a pretty good job. But, it took some time. So all that to say, this Vision Adventure is really for seasoned clinicians.
So it has to create accountability. A new program has to be able to have the patients actually know what they're doing and why they're doing it, and that they're on the right track. It has to be able to measure their progress. And that's where that clinical decision making kind of comes in, that expertise, because then you know how to make sure that your patients know that they're making progress. You know when they start to slow down in their motivation. You know how to pick them up when things get hard. That's why we still need the essence of the doctor in there.
Because, in school, in theory, we're like, okay, so then this week I'm going to do this vectogram. Then the next week they're going to be ready for this one. And then they'll be ready for BIM and blah, blah, blah. And it's like, that is so great on your test. It's amazing on your test. And in real life, it's probably not how it's going to go. And so, but after you've seen all these patients, that most likely with this particular patient population, this is going to take this many weeks to get through this part. It's going to take this many weeks to get through this part. You're probably going to have a hiccup here because now this is hard. But we also know that at this point in treatment, you should start to see these changes. You should start to notice that this is a little bit easier. Check. Have you thought about this? When you're driving, have you noticed that you're more aware of both of your side view mirrors at this point? Because that's something that we want you to start thinking about. And those are the things that our patients are seeing while they're doing their programs. And that's how they're learning that, like, oh, wow, I am making progress in this. And then that's kind of the things that you incorporate it into your program based on the sort of program that you're building. And we go through all of the steps of that in Vision Adventure. And that's why it's, a process. It's not just like, oh, I'm going to record some videos of me doing exercises, because yeah, people have done that.
It's done.
And that's
good for
ish.
Helping people stay
understanding how to practice for the most part. But when it's actually they're not coming into your office anymore, how are they still being treated by you? And that's really the difference there. So we know that access to vision therapy is an issue. We know that the patients who need it are not getting the services that they need. And we know that there aren't unlimited number of us. There aren't unlimited hours in our days. And access to us is difficult because, people are traveling hours from other states to see us. I'm sure they're traveling hours from other states to see you. And so how do you help that person? And how do you still have them get your level of care? How are you getting people who are coming from, we have one doctor who's in Colorado, and he said people take like 3 hours to get to his office. How do you still deliver that care? Because you can't ask them to come to your office, traveling 3 hours each way, once a week. Like, we all want to be great parents, but there's limits.
There's only so much gas in the tank and time in the day. So,
and gas in your car. So
yeah,
there we go. So I hope this answered some questions about Vision Adventure and building your digital program. The patients need it. The population needs it. Our profession needs it. So let's get building.
Let's go.